That's fine. I'm fine.
So, well, good morning, Dr. Douglas Omubo Pepple. Viewers, Dr. Omubo Pepple is a public health professional. He's the immediate past president of the Rotary Club of Port Harcourt, GRA, and basically has been very much involved in creating public awareness about staying healthy, everything that has to do with staying healthy. I'm talking to Dr. Omubo Pepple this morning about how we can stay safe from COVID-19. There's a lot of myth out there. There's a lot of fear out there. And I think that sometimes the fear kills us before the disease itself. So good morning, Dr. Pepple.
Thank you. Good morning, Ibiam, for having me.
And how are you holding up with taking care of those of us who you have to take care of? I mean, you're a public health professional. You have to take care of us when we fall ill. I hope you're staying safe yourself.
Yeah, we're really very safe. We're working really hard, trying to do the public awareness, which is very important at this moment, even a lot more important than even treating those that have come down with the illness.
When it comes to COVID-19, all of us get so scared. What really can I do as a person? How can I keep myself safe?
All right, what we need to know first of all is that COVID-19 is a viral infection. And because it is a viral infection usually run their normal course. And something else that we need to know is the fact that COVID-19 has no treatment at the moment. And what is best to do right now is to prevent everyone from having it. Now, what is important is that one more thing that we also need to know is the fact that we can stop the spread if we all are responsible, if we feel responsible, we can stop the spread. That is also very important to know. And something that we also need to know is the fact that the infection or those that are positive, in most cases, their symptoms are mild. In fact, over 80% symptoms are mild. So most people do even have the virus, present with symptoms, and don't even know that they have the virus. So having the virus is not a death sentence.
Right.
Just like you said, what will kill us faster is the fear, and all the unnecessary things that we do, and the anxiety. That's what will kill us faster. So what I usually advise, or what I usually say, is the fact that personal hygiene is so cheap, very cheap. Everybody can do that without any hassle. But the problem is that it's not something that we already do normally. So, but this is a time to begin to have that as our part of routine. And something as simple and as easy and as cheap as hand washing can prevent you from contracting the virus. Now, hand washing is it's beyond just putting your hands in not running water and then taking it away. You need to wash your hands with soap, and then it has to be under the running water for at least 20 seconds. And you should, as much as possible, make contact with all the aspects of the hand, the front, the back, between the fingers, around the nails. You know, you have to try to make as much contact with the hands as much as possible. And it should be a process that should last not less than 20 seconds.
Wow. So for those of us who fix our nails, doctor, what do? We have nails. How do we get to ensure that we are?
Unfortunately, this is not one of the times that we need to be conscious about fashion. We only have to be alive to be fashion to look very good or look good before others. So right now we need to bring down those nails, because those nails are good households or good culture medium for these viruses. They can quickly stay there, and even if you wash your hands, it's unlikely that you'll be able to have access to all part of the nails that you have fixed. So this is not the time for fashion. This is the time for put those nails down. In primary school, we are taught how to cut our nails regularly and put them down. So this is one of the times that you need to do that. And it is very important. And it is key, yeah.
Well, thank you. But what do I do? So I go out, I come in, I have to wash my hands. But I go to the market and buy yam. I can't wash my yam. So how am I sure that I can still be safe regardless of what I bring into my house? You know, I hear you with hand washing, and now I know that that is critical. But for the rest of us, and then for rural communities where we don't have running water, what do we do?
All right. First, let me take the first part of the question. The fact that I buy yam or I buy food items and eat
Mm-hmm.
the chances of being of contracting the COVID virus from those things are very slim. Now,
Oh,
where the problem you have is the fact that you touch those food items, and if they are already contaminated, and then you touch your face, and then your eyes, perfect place, your nose, and then of course your mouth. Those are the areas where you can quickly contract this coronavirus. So that's why it is important we talk about your hands, because it is the hand that you use in touching the yam. By the time you put the yam in the fire before you eat, you're already destroying the virus as much as possible. So what is important is the fact that you need to wash your hands, because by the time you touch those yam, those other food items that you bought, the walls, the hallway, the staircase, those other places, the office tables that you have gone to, you touch with your hands. And then of course, it has been said that studies have revealed that hand, you touch your face, either your mouth, your nose, or your eyes at least 20 times in 1 minute. So you don't want to use that hand to touch your face. So you have to wash them regularly. So if you wash your hand regularly, you are sure you will prevent this virus at least 99% of the time. Now, the other thing that you talked about was the fact that
my village, I don't have running water.
yes, I understand that challenge, but what is important is that in those villages as it were right now, we what will encourage them to do is the fact that you get someone to help you, assist you to wash your hand. So
Okay.
someone pours the water for you while you apply the soap and then wash your hand.
Oh,
So you do not wash your hand in a bucket where we have like
stagnant
a
water.
bowl where you have water. So you get someone to assist pour the water, make it look like running water. That's what we actually advocate at the moment, and which is also very safe and very useful, because we understand that we come from a part of the world where running water is not as easy as it is in most of the developed countries as it were right now. So we understand that, and this is what we preach and this is what we advocate. And if we do that, it's as good as getting running water as well.
Water. Oh, that's very, very instructive. Now, there are those who say if I have a hot towel, I heat it up and I just clean my hands with it, that's good enough. Is that really good enough?
Oh, well, what we appeal to people to do is wash your hands. It's only when you are not able to get running water and soap to wash your hand, you begin to do those things that you can do temporarily
Okay.
until you get access to running water. So, assuming that you're under a circumstance where you do not have running water, you can temporarily do that.
Okay.
And then access running the same way we use hand sanitizers. If we have access to running water and soap, hand sanitizers they are down there what we should be doing. But because we do not have access to running water in the immediate time, so you just use the hand sanitizer. You can also use the warm towel to quickly clean, and then as soon as you have access to running water, you use the running water. And something you must know is the fact that you use a towel, a warm towel, to clean your hands. It is as you pick up that towel, you rub that hand. You're still using that same surface of the towel that you used to rub the hand to continue to rub it. So you may not necessarily remove all the viruses, all the germs, all the microbes that you have on the surface of your palm that you have picked up at some point. So it is just that you have reduced the microbial load or the viral load or whatever load you have on the surface.
You've not totally eliminated it.
Yeah, so you just did that because you do not have running water. that what we advocate at the moment is quickly go get where you can get running water.
One last question, Doctor. Why are health professionals asking us to stay at home? Why did they say, why can't we go out? Why are they asking us to limit our movement?
Now, the first thing that we should know is the fact that we want to truncate the spread of the virus. And because we want to truncate the spread of the virus, if there is no contact, the virus cannot continue to spread. So if Douglas is not close to Ibim and touching Ibim, Ibim cannot contract the virus from Douglas. And that is why we are telling you to stay at home. So, and the more we move around, the likelihood that we would continue to touch ourselves, the likelihood that we'll continue to constitute crowds and gathering, and the chances of spreading this virus becomes higher, and the chances of controlling this virus becomes difficult for health professionals. A lot of health systems all over the world are already overwhelmed. A lot of health systems are already overwhelmed. Italy and Spain, and a lot of many more parts of the states in the United States are already overwhelmed with what is currently going on. But so that's why we are telling you to stay at home. So that since I'm not meeting you, I will not be able to create an opportunity for you to contract the virus. That is why we are telling you to stay at home. And at the moment, that is the best decision any individual can take, because the control of spread of the COVID-19 virus is really a responsibility for all of us. It's not only that of the health professional, it's a responsibility for every citizen of the world right now. If we are not actively involved, that means we may not be able to contain the virus, and the impact may be very well far-reaching.
Thank you so much, Doctor. Well, my friends, you've heard it from a health professional, not just a health professional, a public health professional. Let's keep washing our hands. Let's keep keeping the distances, the social distances. Stay at home as much as you can. This is a good time to watch all of those movies you haven't watched in a long time. If you don't like Netflix, please watch Africa Magic, or watch Telemundo, or watch the news. There's something to do, or read a book, or just find time to be goofy and silly with your friends and your children in your house.
Learn a new skill.
Learn a new skill. Learn to bake. You can even learn to sing. I mean, that's one thing some of us don't know how to do very well. We just keep causing problems with our voices. So do something fun, and very soon we'll be out of this. Thank you so much, Dr. Douglas Omubo Pepple. It was good speaking with you, and have a lovely day. Keep staying safe for us, and we'll stay at home for you.
Thank you. Thank you.